And we have an opportunity to educate maybe dentists as well as patients out there about an experience that Trina, our patient, had 2 weeks ago. I'm going to say from the dental standpoint, Trina came in to have her teeth cleaned, and then she told us about a crown that had come out, which had a post attached to it. So what we did, of course, she's toothless in front, so we had to quickly build the tooth back up again with a post, and then take impressions for a crown. And she left our office with a temporary. In the course of doing that, I used, from an anesthetic standpoint, Articaine 1 to 200,000 with a very slow infiltration, and I gave approximately 1.7 cc's. So now we're here today to cement the crown, and Trina reports that she had some less than ideal feelings and reaction to the, as I would determine, epinephrine. So Trina, tell us what you experienced.
I experienced a rush of anxiety in the chair and then a complete relaxation. I had almost felt like I had been given some Valium or some kind of a downer. The rest of the experience was okay. What really happened was the next day, after the drug wore off and began to leave my system, I found the experience to be less than perfect. I was beginning to have feelings that I have not felt for a very long time. I have 38 and a half years of sobriety, and the feelings I had were the feelings that I had when I first was getting sober, clean and sober. I felt withdrawal, the cravings came back. I was wishing that I had either pain medication, Advil was not enough, and I continued to take Advil and ibuprofen 500, but the feelings, I wanted more. I also wanted something to do with my anxiety. It took me probably a day, 2 days, maybe 3, to go to the tools that I always have. I started meditating, I started journaling, I started praying, I started listening to different kinds of music, and the feelings began to subside. I was beginning to feel better. My fibromyalgia kicked in and my body started reacting. I was constipated, I started letting go, I started letting loose, and I felt beginning to feel better. Today, as I drove to see Dr. Millert, my anxiety started to raise, and when the assistant and the nurse set me in the chair, it all flooded back. And that's when I decided that I needed to take care of myself and educate him a little bit about addicts and what we can and can't take. I'm sort of thankful in a way that this experience happened, because for 3 years I carried an EpiPen for allergies that I never had to use, and now I know that if I would ever have to carry one again, what to expect and what to warn the doctors and all of that. I think what happened was it just took me back to the early years, and when I was scared to death of the dentist, and the dentist that I had would give me before I came in to have any work done Seconal, Nebutol, Demerol, and then the medicine that they gave to numb, the Novocaine. So I was pretty well addicted by the time I had the end of the dental work done. And I'd like dentists and doctors to know that it doesn't go away. No matter how long you are sober or clean, it just takes one time for all the cravings to come back. And if you don't have the tools to deal with them, you might use.
I think the real important message from my standpoint is, as dentists, we need to be extremely sensitive to those people that have a history of addiction. And the last thing we want to do is trigger them. And in my clinical experience, certain people can be highly sensitive to epinephrine, even in a small concentration of 1 to 200,000. My observation and experience is that women are far more sensitive than men, but I know and feel that this is rather ambiguous in some of the scientific literature, but I hear time and time again patients telling me about their feeling of anxiety after even receiving a small amount of epinephrine. So what we're doing today is we are using bupivacaine without epinephrine, and I really anticipate Trina will have no issues or feelings or effects from the bupivacaine. So anyway, thank you so much. Thank you for your honesty, Trina. I really hope that many people are impacted by this today.
I do too, Jim. And I would hope at some point in education that they put this piece in so that it helps the people that are administering the medicine to understand the effects that it can have.
Thanks so much.